Vienna and Austria always played a very leading role in development and the history of medical developments. And I think beside all the wonderful medical developments and advances we had in the last 2 centuries, I think e-health is a wonderful new instrument to advance the quality of treatment and the quality of the healthcare system. So we see it in the consequence, that's a consequence we would like to stress. And therefore, e-health conferences are a good example to demonstrate the quality and the success of our medical systems.
أنا فاطمة عبد الله من مدينة دبي الطبية. My name is Fatma Abdullah and I'm the Chief Strategy Officer for Dubai Healthcare City. Dubai Healthcare City is the first healthcare free zone in the world, and by healthcare free zone we mean that we aim at attracting and providing services to the nationals of the UAE and people who live there, as well as people who come from all over the world to Dubai, through a variety of healthcare providers from all over the world. Dubai Healthcare City is, and it was created to meet a regional gap in quality healthcare. Many people in the Middle East are not happy with the healthcare system that is available to them, particularly in relation to the quality of care. And what we find is that a lot of people go overseas for various treatments, even though some of it is available in the UAE. So what we want to do is we want to capture the trust of the population and assure them that we're using the highest standards of care, and by bringing physicians from all over the world and nurses and other healthcare workers to provide care in Dubai.
If we actually want to make use of electronic health records, if we want to understand what they mean, if we actually want computers to understand what they mean and use them to help improve the quality and safety of care, then we need to ensure that computers and humans can easily interpret the kind of things that live in health records and the kind of things that live in the world of medical knowledge.
Okay, so I'm Richard McPartland from Tumas Technology, and here we have the first generation vital signs monitor, and we're monitoring ECG and temperature and also the patient ID, and streaming this data continuously over a short range ultra low power wireless link to this PDA here. And if I can just show you here that we're showing the dummies. The dummy has an electronic heart, and in fact, so we can see his heart rate here. And then the data on the PDA is being synchronized over wireless LAN with a back-end server, and we've actually developed an end-to-end system together with Oracle. So it links into the Oracle's HL7 compliant HTTP database. So,
as you mentioned.
well, the key challenge has really been to get the power consumption right down, because there are a lot of wireless vital signs monitoring devices available today, but they usually have very large batteries. And because we can operate off very low power consumption, a factor of 10 or 100 times lower, we can use some very new, interesting type batteries. For example, this is a thin, flexible battery.
Thank you very much.
You're very welcome.
And be able to interpret these together, because unless we can interpret them together, We cannot exploit what's in the electronic health record to do basic things like care planning and to have alerts and reminders of things that are overdue. We have to know what we mean by certain data structures and phrases.
Vienna is a very historical city that, I think it was inhabited over 200,000 years ago. So it's very ironic that I'm speaking about Dubai and the United Arab Emirates, a country which is only 36 years old. So we are very proud of our achievements, clearly, in a short time, but we couldn't have reached where we are today without the help of the entire world and without what we've learned from people across the world that have had major impacts on reducing morbidity and mortality and improving the lives of people. So
Austria is already a leading country in e-health because we are one of the very few countries in Europe, at least, which has a working healthcare system. All the 8 million inhabitants of our country already have an electronic health card, and we already have a network of almost 11,000 healthcare providers which are linked to this system. So we do have a basic system which is allowing us now lots of new applications in the e-health sector. That's what's the one reason. The second reason is that we are really working hard on a nationwide electronic health record system, which will allow to participate all the healthcare providers, hospitals and outpatients organizations, and each and every citizens in this country. And we are progressing in this work very well. We have a lot of political commitment behind that. So we are also, Austria is a showcase actually in the new development of e-health.
Show on this side RFID for tracking that really supports the improvement of quality in the healthcare system, where you really all the time have a very close connection between the patient and the medication. We also have advanced decision support solutions that helps the doctor.
Now, the tool that is being promoted most strongly as a tool to help in this space is known as an archetype, a clinical archetype or an EHR archetype. And this is something which was pioneered by the Open EHR Foundation, but is now also in Part 2 of EN 13606, a full European standard. So this is no longer at the invention place. This is now a European standard, a de facto way of representing information that defines clinical data structures within an electronic health record.
internet penetration في الإمارات in the UAE is very, very high. It's very, very high. So,
especially in healthcare sector.
Well, people don't generally use information for healthcare other than to find out about their diseases. يعني they use websites like WebMD. اللي عنده صداع مثلا يروح يشوف في الإنترنت شو سبب ممكن يكون أسباب الصداع etc. بس in the Arab world, I think in general, not just in the UAE, people don't generally use healthcare for IT purposes. IT for healthcare purposes at this stage. But I'm sure this will change as more and more people use IT in general. So, I mean, who would have thought that? I mean, the young generation of today are very electronically, savvy. They use the internet and they use IT systems very, very easily. The cell phone is a very, very important part.
Okay, my name's Chip Means. I'm the web editor for Healthcare IT News EU, and we're the publishers of Healthcare IT News in the States. And we're here both working as journalists for the conference and presenting our website and e-newsletter to the healthcare IT providers in the EU space. Thank you. Thank you.
Hi, Ceres is about Ceres International. We're a UK-based company. We've been going for about 16 years. And basically what we do is we do social health care covering sort of palliative care, community hospitals, outreaches as well as drug and alcohol abuse centres. And what our system does is basically integrate one business application to cover the care, the support. Yeah. Well, basically what we've won a couple of awards. We've won the Foster and Sullivan Initiative European Award. We won that last month in regards to our system that's based out today. So, and we've also won the Taiwanese Award, basically for an inefficiency, again, for a single system.
And what is your expectation from this symposium?
Just to see, it's the first time we've been here, so it's just to see how we get on and basically see if we can get any clients from it.
EUROREC today is involved in a number of European-funded projects. It's coordinating QREC, the one dealing with certification, but it is also partner in other projects such as EHR Implement, which is dealing with organizational, legal, social, ethical issues when implementing at national levels EHR systems, and RIDE was dealing with semantic interoperability.
Those switches, yes, years ago, when the company was founded, everybody called something about global switch, global traffic, global, so on. So, but in the meantime, our company just plans, builds, and provides data centers, big data centers. So the smallest data center we got in our group is about 10,000 square meters, and the biggest one is in London. We got 66,000 square meters data center space. And the reason why we are here is just to bring new solutions for the hospitals, because the IT in hospitals, that's not the core competence. Now the question is where the IT, which is more and more complex, where they could bring it out.
See, the Austrian government is always very involved in bilateral and multilateral work. You know, we are strongly supporting the work of the European Union, the European Commission, and the European Union in general in e-health developments, and we are also involved in the developments which are going on the grounds of the WHO. But we are stressing more. The more important for us is the development within the European Union. Austria is also participating in a large-scale pilot, which is starting now, to find out more about the interoperability of e-health systems within the European Union.
There's a lot of effort that goes into that, and we have numerous bodies that specifically focus on bringing conferences and events to Dubai, some of them being health, and we work very closely with those bodies the Dubai International Trade Center, as an example. We work closely with them. We are the major sponsors of Arab Health. And Arab Health has now become one of the largest health conferences in the world. I mean, it's now larger than Medica, even. So, so Arab Health is a major event that happens through the year. We also host numerous events in Dubai that Dubai Healthcare City sponsors or is involved with.
Once a hospital decides on the software they're going to use and the type of hardware they're going to use on the IT, they have to integrate all that equipment into the clinical area, and that's GCX's specialty. We mount the vast majority of patient monitoring systems worldwide, and along with that expertise is the ability to mount IT hardware and integrate it into the operating room, the intensive care unit, the emergency room, everywhere in the hospital. So we're sort of the anti-gravity part of the equation, so that we're at the end of everybody's rainbow. Eventually you have to integrate the equipment so the users can use it, and that's what we do. We've always done mounting. We've been mounting patient monitoring systems and medical devices for over 35 years, and we've just extended that expertise into the IT world as the need for electronic patient records has grown worldwide. So as GCX changed and modified its product line and applied its expertise to help doctors and nurses integrate this equipment into this very, very tight environment. It wants to use the same combination of IT hardware. So it's our job to stay ahead of the market and understand what hardware they might use, if it's different types of flat panels or flat panel PCs or separate CPUs or different size laptops, because laptops are getting bigger again. And it's our job to stay ahead of that particular part of the market so that we can offer solutions to help them mount it once they need to use it.
Thank you very much for the moment. We'll get back to you later.
Thanks.
Here today, using the advanced functionalities of MetaVision to improve patient safety, reduce costs, support billing, improve the outcome of the patient, and of course to facilitate research, and then give you a short summary.
Do you feel good being in Vienna, in fact, and having this conference in Vienna? Yeah, were you expecting that in Rome?
People. Yeah, Rome it's better, but
because of your hometown.
Because I came from Rome.
What we do have, if we cross borders, and even if we cross borders within our own country, you know, from one province to another, we have to make sure that the different IT systems in hospitals or in outpatient organization or within the social security system is interoperable. And so we have to define common standards in identification, in technical standard frameworks, and in the building of registries to find the information we need, to locate the information we need. So we have to work on common standards in Europe and worldwide, but first of all, we have to do that within the European Union, of course, because the mobility of patients is becoming more and more important. And so we have to make our systems interchangeable.
Why? Because you see people coming here from all over the world, and they are more relaxed. Instead of, if they are at home, they have to deal with the mail and all the things. So that's the reason why we are here. If we see from at least what we have in Scandinavia, we have a lot of things that we can learn down here in Austria within the telemedicine area.
Thank you very much.
Thank you.
I'm here representing a technology company that provides solutions for healthcare. We effectively enable organisations to effectively manage their electronic patient record. So we take the paper part of their record and make it available as part of the treatment that they receive, irrespective of where they are. So I'm here to promote our software as a role model.
In what field?
That's a difficult one to answer. I'm part of the UK. We're going through a major program at the moment in the UK. In terms of Austria's healthcare, I'm here to learn, find out as much as I can about it.
All the surveys we conduct in that field tell us that the people that our populace is very eager to participate because they intuitively notice the big advantage of having health data available, time without any time, and independent from the location where you are right now.
Problem, they're not getting their internet connection.
Management auch mit der Auswertung und Verarbeitung der Daten, sondern auch auf den Critical Care, wie es heißen. Und eines der Systeme, das Sie hier sehen, heißt IntelliView Clinical Information Portfolio for Critical Care. Ist ein System für den Critical Care Bereich, deckt alle Einheiten ab von Acute Care über Intermediate Care oder auch General Ward bis hinab zu den Intensivstationen und auch ED Department. Also ein flexibles System, das Sie frei konfigurieren können für Ihr System, für Ihr Krankenhaus, wo Sie die ganze Flexibilität haben, Ihren Workflow abzubilden mit einem integrierten Datenmanagement. Und das Wichtigste dabei ist noch, dass Sie auch sogenannte Clinical Advisories bekommen. Das heißt, ein System für den Clinical Decision Support, mit dem Sie Regeln aufsetzen können, wo Sie frühzeitig alarmiert werden, dass mit Ihrem Patienten möglicherweise etwas im Entstehen ist, zum Beispiel eine Sepsis.
About the healthcare, the Jordan government looking for implementing an e-health solution to connect all the healthcare sector, the army sector and the Ministry of Health sector to have one medical record around the Jordan.
We are making progress in Austria. We once again we were able to implement our electronic health card system within very few years, and we are really on the forefront of this development. But see, this is we're all talking now about the interconnections of different healthcare providing systems. Within our hospital systems in Austria, we have a long-standing tradition of hospital information systems. We already have cores of telemedicine applications working. So that if you go deeper and look closer to our hospital systems or in single hospitals, you will find lots of applications, e-health applications already.
In clinical and administrative parts of healthcare, there's so many codes. There is ICD-10, ICD-9, CPT, OPCS. There are codes, and what do they mean and how they relate? And how does an information system take those codes and make use of them and enable transition of those codes across international boundaries? So we're about interoperability. We're about the ability to map content and help facilitate the use of content within applications. I mean, today, the ability to have clinical information, the actual coded correctness for pharmaceuticals or for certain conditions of a patient, computers can't work on text alone. If you put text into a computer, it doesn't know how to deal with it. But as you put structured data into a computer, it can then start to use rules to help decide, is this medicine good for this patient in this situation, yes or no? Well, we provide that content, for the structured tools, that then rules can be written against.
Phase 2 of our project, which is about 3 kilometers away from Phase 1, is what we call the wellness community. The wellness community is focused on alternative medicine and complementary medicine services. It has environments where people can go and get checkups, and these are people who are well or recuperate after illness. We have rehab facilities, long-term care facilities for both adults and children in the second phase of Dubai Healthcare City, as well as huge residential and healthy living kind of area.
I think Austria can be a role model for e-health developments, and we also can be a role model in empowering patients and health providers to get the right access and to immediate access to information and knowledge. I think e-health, as we understand it in our Ministry of Health in Austria, is a wonderful tool to get access to information and knowledge in the healthcare sector.
So the message is that we continue to learn from the world and try and refine it and work on it and put a Dubai label or a UAE label on it and look it up.
Great.
Thank you.